Hello, my friends. As I have seen many people listening me in English, I'm following this path, and I will make my vlog in English too. First of all, I was asked by many official and unofficial people what I am doing, why I am discussing about this disease, COVID-19, while I'm not a doctor, a human medic. And my answer is I'm doing it for friends. I'm doing it from my veterinarian perspectives. I was working with COVID for many years, maybe 20 years. There are existing this disease on cats, very, very serious condition, feline infectious peritonitis and pleuritis, and there is the dog coronavirus. So I'm dealing with corona many times, many years ago, and I have seen the the situation in June, in January. I was invited to a meeting in February, early February, and I was saying to that meeting that this kind of meeting we will not have for many months by now. They was laughing. Now they are considering me as a, I don't know, um, predictor. Well, I have made a prediction. It was just an information. Crude fact is that this virus might be originating from vaccine research. It's like a escaped vaccine candidate from Wuhan. Maybe somebody was taking animals from biobase from Wuhan, and so those animals has been sold in a wet market, in a fish market, maybe 10 or 11 miles away, not very far, which makes this situation to go all over the world. Also, the reaction of the Chinese authorities, the Chinese New Year, and so on. Well, this is one about the vet disease, of animal disease, which is bird flu. All the animals has flu. Most of the animals has flu. One specified flu virus, but these are passing from one animal to another. And the birds are considered to be mostly the aquatic ones, considered to be reservoir for these viruses. Also because they make a digestive form. And this virus can spread through hybridization. It is a RNA virus like corona, like AIDS, but totally different. It is the genetic material. It is fragmented in chromosome-like structures. I mean, they are they are they are capable of doing recombination in case of combined infection. I mean, uh, I'm explaining this. It's like an animal getting the one strain and another strain of the virus in the same time in their cells. When they rebuild the new viruses, they can use genetic materials from both, and make a hybrid. This was the situation maybe with the Spanish flu, with a pig virus adapted to human, or hybrid with a human and pig flu, most likely. And also other kind of bird flu and so on, which was escaping from Asia in the previous years. So this is the situation with they have two markers. It is hemagglutinin, which is producing coagulation, and it's age, and N from neuraminidase, it's an enzyme for fixation. Well, these markers are studied because these are pathogenic markers. They have other proteins too, but these are studied. And you can see that human has only the small figures. There are many kind of age and n, like 18 or so, but humans get only 1, 2, 3, and maximum 3. This our fluids age 1 and 1. But we received H1N5 from the birds. And there is now in bird population the H5N8 in India, in Europe, maybe in Romania too. We are waiting for typization for the N antigen. They don't know exactly whether it's 5 or if it's 5, it's serious. But it's N5. It's H5. It's the neuraminidase antigen. Well, there is no total big concern because as a zoonotic disease can spread to human only in certain conditions in Asia mostly than Asia mostly than in Europe. About coronavirus. Again, I'm saying that I'm not a human doctor. I'm not a physician. I am just or a virologist. I am just a vet interested in science and in corona particularly. I'm not reading. I'm looking to this thing. Well, it's difficult for me to read in English so fast. Well, in this case, there are some news. You have to follow Dr. Campbell. He's a very nice guy, and he's very good in explaining things like medicine to normal people. He was stating that Oxford Institute was making a research under 172 hospitals, where they realize that this treatment with plasma treatment, it is not so useful. There are no positive results by treating people with plasma, which is logic, because plasma has been used and it is widely used on critical patients. Like let's use everything we have, but in that moment when the critic period is rising, there is no more viremia, no more reason to deal with the virus. You are dealing with inflammatory response, coagulation, and so on. So it's not the case. Dexamethasone was much better than plasma, and it's extremely cheap, much cheaper. Also, viral drugs, antiviral drugs, doesn't show too much efficacy. I mean, there are the Kaletra one and the Remdesivir one, and also the Umfenovir, which is from Russia, Arbidol named, or Arbivir. It is not proved to be any help. Also, hydroxychloroquine hasn't been used. Almost in all the possibilities has been tried, many dosage, but nothing specific or particular. No results, no positive results with the hydroxychloroquine. Okay, dexamethasone used, and it's used, and you can use monoclonal antibodies, but at the beginning of the disease, on the viremia, I mean those which has a diagnostic, doesn't have symptoms, doesn't have symptoms. In that moment, you can use antiviral drugs and antibodies. In that moment, you can use plasma. In that moment, you can use monoclonal antibodies. In that moment, you can use antiviral drugs. But generally, they are not used in this situation because 99% or 95% of the people doesn't require anything when they when they go through this disease. And you have no reason to assume risks of using like plasma, where the patient is normothermic, no fever, no cough, no nothing, just a positive infection. But that is the moment theoretically when this product antiviral solution can work. After you have clinical signs, goodbye the virus, goodbye the antiviral drugs and antiviral treatments. Okay, about the strain. I've told you I don't remember. I think I've told you that uh, why is the reason we have find so many strains now, and there was no new strains in the beginning. I mean, in summer, in let's say summer, let's say June, because I'm speaking for in English. I'm speaking from South Africa or Australia too. So in this month there was no specialized or important modification, genetic modification, and now they are coming like once a week. The British variant, the South African variant, and the Brazilian variants, because there is one researcher there said, one in Britain said, in England said it's two cases, two strains, two modification. But there is one local one who said, the virologist who said it's three or four, and there are 12 mutation, 12 modification of the peptidic chain on the spike protein, the fixation domain on the virus, which are including the one in South Africa and the one in England, the 501 and the 484, where the amino acids are changed from asparagine to tyrosine, and from what is here? It's glutamic acid to lysine. So why is this happening? I'm not coming with details. I'm just coming with some explanation, some possible explanation, my explanation. Why we have in January three mutation in three places, three important mutation, and none last year. First of all, there are more cases, but second of all, there are many people with some kind of immunity, and this mutation is coming naturally to overcome this immunity. Also, there are more and more this virus is more and more adapting to young ones, because it's, as I said in the beginning, a vaccine candidate, I think, and this one hasn't been totally adapted to human. I mean, he was attacking old ones, the one with disease more seriously, and less the young ones. But as this going through population and it's getting new mutation, this can lead to evolution of the virus through human population, and to get more and more sticky to the young ones, sticky to those which has some immunity. Although a British study which has been made on people working in a medical service, stating that only 0.06% of those which has infection are prone to have another one, which is good if it's so, which is extremely good for the moment. We don't know what will happen with this virus later on. We will not lose it. We will not lose it for the simple reason that it is so broadly distributed. And the genetic of South Africa, Brazil, it's very wide genetic population, human population, which can lead to a diversification of the viral genetic there, as the human genetic are so different, from European blonde Nordic European to black Africans, dark skin African. Well, there is a good, and the humidity from Amazon forest in Manaus, sorry, in Manaus. It's a big issue with this infection. They have shortage of oxygen in hospitals, even for young ones, for premature birth. They have shortage of oxygen. It's interesting. They have shortage of oxygen in Brazil, with the planet lung, when they are preparing to remove the Amazonian forest and to put grass for cows. They didn't start vaccination. They got some vaccine from China, Coronavac and Sinovac, and they try to get some AstraZeneca vaccine from India, but they haven't started the vaccination. Everybody knows the reason. I don't want to mention, but they are. When you have, when you don't believe in something, you are more prone to receive the side effects. And this is an effect of not believing in disease, not believing in social distancing or physical distancing, not believing in vaccine, not believing in the disease as a whole. Now this is what they get. New strains, because it's distributing too much. It is extremely dangerous. I'm saying this as a vet perspective. The reason we kill everything with the vets, we kill any animal which is susceptible or has receptivity to a specific virus, a specific new disease. It is that we don't want volumes. We don't want volumes of infection numbers, because these numbers can lead to adaptation, modification, evolution for the virus. Chances. You have numbers. You give chances to the virus to grow, to evaluate, to modify. As we have now people which are have some degree of immunity against this virus. Now we will have new strains. After we will do the vaccination with Pfizer, we might have some other strains of virus which are bypassing the Pfizer immunity. It is possible. It is possible, but we are positive thinking about the possibility of changing the genetic material from the RNA Pfizer vaccine, Pfizer, Moderna, whatever. Also, using different kind of vaccines, it is also dangerous. And now keep this in mind. What I'm saying now, it is that we should have a protein, a virus-like protein, which has been given nasally or intraocularly many times a year, with many strains of virus, many types of proteins which are copying the virus strains, and to produce a local immunity to the respiratory mucosa. In this case, we can stop the infection and the transmissibility. Vaccinating by shot, by injection, we will have immunity, but we are not sure about the possibility of stopping the transmission. Very unlikely to stop the transmission while you receive the vaccine only, the injectable vaccine. So we have to follow. I mean, it was developing technologically in many directions because there was a lot of mobile phones, and so there was a lot of demand on this communication. But we didn't develop enough in microbiology, in molecular biology, and things like that. Normally, a human population with our level of technology can produce like this a new protein with a stereochemic shape like the many strains of corona or other diseases. Just like that. But there was no reason. With this research with corona, we will find protein to fight against cancer, because cancer has some specific markers. You can kill the cancer cells by directing antibodies against them. This is possible. This is done. Has been done. Has been done from years, but there was not enough interest and money involved. We speak about billions of Pfizer. We don't speak about trillions with Xiaomi. Or I don't know what kind of Exynos or whatever processor made by whatever who do it. So, conclusion: intranasal vaccine, evolution of the biochemistry and molecular biology, and let's follow this situation and the vaccine. Let's follow this virus mutation. We will find more also because we work more on genetics. Have a nice day.